We've been talking obviously a lot about COVID. I mentioned before we just went to break that we've talked a lot about the issue with surgeries being postponed for so many people because hospitals were so crowded, primarily with COVID patients. Well, we've seen that situation change. I think I mentioned off the top of the show today that it's now been 10 days in a row for the first time in quite some time, possibly ever, that hospitalizations have actually gone down with relation to COVID. But there has been an issue with transplants, and they don't get talked about an awful lot. So we wanted to bring up to date on what exactly is going on with these because the situation is difficult, to say the least. Louis Beaulieu is Executive Director of Transplant Quebec. And Monsieur Beaulieu, thanks for being here, first of all.
It's my pleasure.
Yeah, I want to talk about this number that, again, doesn't seem glaring, but when you consider it's as bad as it's been in 10 years, it's worth pointing out. So the number of people waiting on transplant lists is up 10%, and that's the biggest increase you've seen in 10 years. How much of this can you sort of qualify has to do with COVID, or can we even make that association?
In fact, we do believe there's a clear relation with the increase related to COVID because, for example, in 2020, the renal programs for kidney transplantation were closed for more than 3 months. So no renal transplantation was done that time, and those patients that were in the waiting list were, if they receive the transplantation later, or maybe not yet. So that increase, we do believe, is clearly related to that. And also the difficulty to get to the OR, the operation room, is something we still face actually.
So when you say to get to the OR, explain what that means. What difficulty is there?
Well, when we have a potential donor that we have to procure organs, we face delays to have access to the OR because there's the lack of personnel to do that, to do to operate the room. Mm-hmm. So that has an impact on the family refusal rate that increased also in 2021 from 21 to 26%. So more families are decide not to help the realization of donation because they are so tired of the stress that come with the loss of the beloved.
And how do you deal with this? I mean, is this simply the government? I mean, we can't create extra personnel. We know so many have left because of COVID within the healthcare system. How do you solve this problem or begin to solve it?
Well, in fact, we work as much as possible in consultation and collaboration with the teams in the hospital. So we try to find the best way to manage delay and explain to families that it's out of our end and that everybody is doing the best. And so for many families it's okay, but for some families it's too much.
So with people hearing this now, and by the way, I will tell you that I was kind of surprised. I see heart transplants are up, and they are actually up by a lot, but you mentioned renal and lung transplants, they're not affected as much. Why would that be?
Well, in fact, talking about lungs, it's that there's another surgeon that came to the team about 3 years ago, and the trend that we see from 2019 is still there because lung was one of the best year, in fact, the best year ever. So 72% people were transplanted in 2021. So that is actually good news. And for kidney and liver, the waiting time is low, but it's still too high when you think about more than a year and a half of waiting on the transplant list. This is very long.
Are other provinces doing a better job than Quebec in this respect?
Well, we see in BC a record year, actually in 2021. A third of the donors are related to overdose of drugs. So that explains some of the success in BC. And in Ontario, there were a diminution of 25% of the volume of donors in 2021. In Quebec, it's about 20%. So we are not doing so good, but we are not doing so bad.
Mm. And what are you asking specifically the government to do? How do they get involved to fix this situation, or can they fix it?
Well, we do believe in Quebec. We need better legislation to get precision, to make it more clearer, and to help have more referral. For example, in Ontario, there's more than 5,000 referral. In Quebec, we were 724 referral in 2021. So we should be somewhere at 3,500 referrals. So to make that happen, legislation should be modernized and improved.
In what sense? When you say modernized and improved, how, though? Just can you give me an idea?
Well, in fact, about the consent, we should make it stronger. We should have a better role for families and act only where they should act. No more, no less than a contribution to help realize the will of someone that decide to give organs at the death time. And also we should improve referral, and that will be to expand the scope of the number of patients that should be referred to Transplant Quebec with less condition than actually.
Understood. All right. Monsieur BEAULIEU, I thank you so much. Appreciate your time today.
Thank you very much.
And good
Bye-bye.
luck.